So I'm going to shoot a quick video for you guys and see if I can give you a better understanding of why you may be having sciatic nerve pain. It's not a cure-all. It doesn't mean that it's the only reason you could have sciatic nerve pain, but in the 8 years that I have been treating, oftentimes you come in, you grab your hip, something hurts, and your piriformis is impinging the nerve bundle that feeds the lower extremity. So you can feel this in the side of the leg, you can feel this in the front of the leg, you can feel this just through the glute, sometimes it even creeps up into the low back, and that's because the sciatic nerve main bundle has several endings that feed the musculature around it. But hey, let's take a look and see if we can help you understand yourself a little bit better. Okay, so sciatic nerve pain is probably one of the most common and the easiest things to treat. Most people come in and they point right here and say, oh, I've got a knot in my piriformis and I need my sciatic nerve released. So let's see what that actually even means. Sorry, I'm not a lefty. There we go. Well, if we take away the glute max and we look in a little deeper, we've got your piriformis. And your piriformis connects at the greater trochanter and inside your sacrum. There's a lateral view and a posterior view. Now your piriformis is involved in a couple motions. Lateral hip rotation, and hip adduction. Just fancy for moving it away from the body. So if you look at the lateral hip rotation, you can see why pigeon feels so good. To wrap that foot up underneath you, straight out in front, and lean over it. Because it really pulls the greater trochanter away from the sacrum, which is where you're attached to. Now that you know what your piriformis is, let's find your sciatic nerve. So here's your sciatic nerve, and we'll give you a better view of that. Here's a lateral view, and here's a posterior view. So let's look at them both in tandem. The animals are going crazy. They want my attention because I just got home. So I would like to look at the sciatic nerve and the piriformis, and I would like to fade the rest. Don't Binks. Okay. So oftentimes we get a trigger point right in here. Binks. Go. You can self-treat your piriformis with a tennis ball or a lacrosse ball. You can also use a foam roller. Maybe